Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe, and share. Understanding bone fractures. The basics of simple and compound breaks. A bone fracture is a break in the continuity of a bone, which can occur due to various reasons such as trauma, overuse, or diseases that weaken the bones. Our bones are strong but not invincible. They are designed to withstand a lot of stress, but they have their limits. When a force exceeds what a bone can absorb, it can crack or break. This can happen during accidents, falls, or high-impact sports. Simple fractures, or closed fractures, involve a break where the skin remains intact. These are generally less severe and easier to treat. Compound fractures, or open fractures, involve a break where the bone pierces the skin. This type of fracture is more serious and requires immediate medical attention. Simple fractures range from hairline cracks, which are small and often hard to detect, to complete breaks where the bone is entirely separated. Compound fractures create an open pathway between the fracture and the external environment, increasing the risk of infection and complications. The key difference between simple and compound fractures is the integrity of the skin. Simple fractures do not break the skin, while compound fractures do. Simple fractures have no open wound, which significantly reduces the risk of infection and makes them easier to manage. Compound fractures require urgent medical attention due to the risk of contamination and infection. Proper cleaning and treatment are essential to prevent complications. Spotting the signs, symptoms, and visual differences. Common symptoms of fractures include intense pain, swelling, bruising, and loss of function. Simple fractures show swelling and bruising but no open wound. The limb may look deformed or misaligned. Compound fractures present with an open wound and possibly protruding bone. Significant bleeding and visible tissue damage are common. Immediate priorities for compound fractures are controlling bleeding, covering the wound, and immobilizing the limb. Avoid moving the injured person unnecessarily. Early identification and proper first aid are crucial. Timely medical help can significantly impact recovery. Causes and mechanisms. How these fractures occur. Fractures occur when a bone is subjected to a force it cannot withstand. Traumatic injuries, stress fractures, and pathological fractures are common causes. Simple fractures often result from moderate force, like falls or sports injuries. Compound fractures are usually due to high-energy trauma, such as motor vehicle accidents or falls from significant heights. Underlying bone health, like osteoporosis, can influence fracture severity. Maintaining good bone density is key to preventing fractures. High-energy events can lead to compound fractures, especially in weakened bones. Pathways to healing. Treatment strategies for simple and compound fractures. Understanding the right approach is crucial for effective recovery. Initial treatment involves thorough assessment and stabilization of the injured area to prevent further damage. For simple fractures, non-surgical methods like casting or splinting are common. These methods help immobilize the bone, allowing it to heal naturally over time. Surgery may be needed for complex simple fractures that cannot be aligned properly with casting alone. Compound fractures require immediate surgical intervention to clean the wound and stabilize the bone. This is crucial to prevent infection and ensure proper healing. Intravenous antibiotics are used to combat infection, which is a significant risk with compound fractures. External or internal fixation may be used depending on the wound's contamination and the fracture's complexity. The primary difference in treatment is managing the open wound and infection risk, which is more pronounced in compound fractures. Simple fractures rely on the body's natural defenses to prevent infection, with regular monitoring to ensure proper healing. Compound fractures need aggressive treatment to prevent complications, including potential infections and improper bone healing. This often involves a multidisciplinary approach. The road to recovery. Timelines, complications, and long-term outlook. Understanding the journey to recovery is crucial for both patients and healthcare providers. Recovery timelines vary significantly based on fracture type, severity, and the overall health of the patient. Each case is unique, requiring personalized care and attention. Bones generally take 6 to 8 weeks to heal significantly, but this can vary. Factors such as age, nutrition, and adherence to medical advice play a role in the healing process. Simple fractures have a more straightforward recovery with physical therapy, often involving exercises to restore mobility and strength. Compound fractures, however, have a higher risk of complications like infection and delayed healing, requiring more intensive medical intervention. Multiple surgeries and extended rehabilitation may be required for compound fractures, emphasizing the need for a comprehensive treatment plan. Simple fractures heal within a closed environment, minimizing infection risk and often resulting in a quicker recovery. Compound fractures need urgent surgical intervention to clean the wound and stabilize the bone, preventing further complications. Understanding these differences helps set realistic recovery expectations, allowing patients to mentally prepare for the journey ahead. Active participation in the recovery process is crucial for regaining full function and strength. Engaging in prescribed exercises and following medical advice can significantly enhance recovery outcomes. UMCC, your ultimate medical consultants connectors.